Huge announcement was made yesterday at a briefing in Birmingham, with a statement later released by the government. Birmingham, along with Sandwell and Solihull, will now see further restrictions starting from Tuesday, September the 15th. Birmingham, Sandwell, and Solihull will now be placed in lockdown restrictions following a steep rise in coronavirus cases. Joining us is Director of Public Health, Dr. Justin Varney from Birmingham City Council. Dr. Varney, thank you for joining us in this conversation. And I'd like to start by understanding from you about the R number, which is said to have increased and has caused the new restrictions to be introduced. Please explain our viewers what the R number is and how does it affect the coronavirus cases.
So the R number is the average number of days it takes for us to double the number of cases, and we only calculate it at a national level, not at a local level. So there isn't an R number for Birmingham, but the R number nationally is now between 1 and 1.2, and it's taking on average 7 days for the number of cases to double. So we are in a space where numbers are rising rapidly, particularly in areas of the country like Birmingham. And so we are seeing restrictions reintroduced again to try and keep us safe and try to halt the spread of this virus.
Yeah, and I'd like to tell the viewers what the lockdown measures will mean, that the households from all these three councils will not be able to mix with each other from 15th September. Doctor, we also saw a report past week that students from King Edward School in Five Ways and Hall Green were sent home after testing positive. So, do you think that school reopening on 1st September has caused this steep rise of coronavirus cases, and this decision should have been avoided for at least the month of September?
So I don't think we're seeing any link between the schools reopening and the rising cases. The rising cases is across all age groups and across all ethnic groups as well. What we're seeing in schools is often one child is symptomatic, and the requirements are if a child tests positive or a member of staff, then everyone in that bubble get sent home. And unfortunately, this is a time when normally children go back to school and we see coughs and colds start to appear every September. And the national issue there is with access to testing means often many children are being sent home and are waiting a few days for a test rather than getting them straight away. And we don't know whether it's COVID or not until they get the test.
Yeah. And why are the restrictions uh, are only limited to households not being able to mix with each other? Because the previous lockdown saw a number of restrictions placed about even going out only for exercise or grocery store shopping, and but this new restriction did not include anything about face masks or personal hygiene. So why is it only limited to households not mixing with each other?
So first of all, the guidance on face coverings hasn't changed. You should wear a face covering that covers from your nose to under your chin whenever you're going into a building that you don't live in, or if you're going on public transport. That's the same. The instructions to keep washing your hands and avoid touching your face remains the same. The guidance to keep 2 meters from anyone you don't live with remains the same. The difference in Birmingham, Solihull, and Sandwell is that what we have seen is an increase of cases where people have been gathering in private, whether that's coming together for a party or to visit each other or to join in prayer and celebration or in mourning, that behind closed doors, they're forgetting to keep the distance, they're forgetting to wash their hands. And as they pass love and friendship with each other with physical hugs and handshakes, they're sharing COVID. What's different outside of the home is if you're in a restaurant or you're at work, there's a risk assessment. There's a plan in place. There are stickers on the floor. The tables are separated. So there are things that keep reminding you to stay safe. And unfortunately, what we're seeing is that at home, people are just forgetting. And that's why it's spreading so quickly between social networks.
Right, because of course, the restrictions not being placed in public places and gatherings in public places has also raised question if this is a false alarm by the government just to keep people in and reduce the risk for the winter that's coming ahead of us. And there's a risk, of course, that the cases might still rise in the winter. This is the first time after January and February when the breakdown actually took place in England, when the winter would come again, and the risk of a second lockdown is also coming. So, how would you justify? How what would you tell to people who are thinking and presuming it like a false alarm?
So I would say this is definitely not a false alarm. Over the last 10 days or so, we've seen 7 people admitted to intensive care because of COVID. We've seen the average number of admissions rise from about 1 a day to now running above 4 to 5 a day. So we need to really kind of be alert that we are seeing that rise in hospitalizations now, which is trailing about 2 weeks behind when we first started to see an increase in cases in the community.
Right. Doctor, in the past, we have seen a report how people from ethnic minorities and the BAME community have a 40% more chance of being infected with COVID-19. Do you think with Birmingham, with such a massive BAME community population, is that is why Birmingham, Sandwell, and Solihull have been targeted to keep people from these communities, under restrictions so as to reduce the risk of spreading of the virus?
So, no, is my simple answer. It's really important to recognise the reason that we have the additional restrictions is because the rate of cases in Birmingham is now 80 per 100,000. In comparison, somewhere like Dudley is only 24 per 100,000. So this is nothing to do with ethnicity of the city. This isn't Birmingham being picked on. This is the fact that we are seeing an increase in cases in the way that Greater Manchester did, Leicester and Bolton, and we have to act now to get this under control. In terms of whether there are increased risk for particular ethnic communities, what we know from the research now is that many of these communities continue to work during lockdown. We're in jobs like taxi drivers, security men, we're chefs in kitchens. So they continue to be exposed where people who worked in offices were able to work from home and therefore weren't as exposed. There is no evidence of any difference in your ability to catch COVID between different ethnic communities. What we're seeing across Birmingham is that all communities have had a rapid increase in cases. There are different numbers in different communities. And again, that probably reflects people's jobs and what people are doing. But actually, in
Hmm.
reality, this is affecting all of us.
Right. But, Doctor, the state of the fact is that Birmingham, Sandwell, and Solihull do have a massive BAME community population. So, what are the efforts made by the council and the government to promote the campaigns, awareness campaigns about coronavirus and the measures that we should all take in these councils for the BAME community?
So obviously I can only really talk for Birmingham, but I know in Solihull and Sandwell, my counterparts are doing very similar things. So obviously we're working with media stations like your own to get messages out. We've been translating some of the national campaigns. So if you follow the Healthy Brum account on Twitter or Instagram, you'll see we've taken the hands, face, space poster, and we've translated it into multiple languages. We have commissioned community organisations to work with us, as well as local media stations, to produce not only content in English, but also content in other languages as well, to ensure that everyone in this city knows what they need to do to stay safe from this dangerous disease.
Right. Doctor, with Boris Johnson making an announcement for people to not mix more than six in a group, and now Birmingham looking forward to this massive lockdown measures coming for 15 September. And as we said, hundreds of students were sent back from the school after they tested positive. There is a confusion in community regarding different kind of messages coming from various places. So, what would you say to everybody watching? What is one common thing that everybody should follow in at least the wider West Midlands area? And of course, the people who are sending kids to school, what are the new measures for them?
Okay, so from Monday, for the whole country, the rule of six comes into effect. And this means that we should not meet in groups of any more than six outside of our homes or inside of our homes. And that's for everywhere else in the country. In Birmingham, Sandwell, and Solihull, you can't meet anyone in your home or in your garden. You have to meet them somewhere like Temple or in a workplace or at a restaurant where there's a risk assessment and risk management in place. And that's a restriction rather than full lockdown. It's really important that we all keep in mind this 2 meters apart. We need to keep that social distance whenever we're outside the house we live in. We have to keep washing our hands. We must wear face coverings from our nose to our chin if we're going inside to a building that we don't live in. And we have to stay alert. There are simple things we all need to do. Wash our hands, keep space, and put a face covering on our face. Those are simple actions, but they are actions that stop the spread of this disease.
Right. Uh, but doctor, why wasn't any measures or any restriction put on pubs or restaurant or places of worship? Because that is a potential place of catching the virus. People do mix with each other in places of worship. So, do you think in future we might be looking towards having restrictions placed in these other places as well?
So I suppose the way I would describe it is think of this a bit like fire safety. So if you go to a pub or a restaurant or to a temple or a gurdwara or a mosque, they all have a fire plan. They've all got fire extinguishers and fire exits, and they have fire marshals and people whose job it is to keep an eye out for if there's a fire. You don't have any of that at home. So this is similar. When you go out to a restaurant or a temple or a mosque, or to a gurdwara, they will have a risk assessment, they will have a plan in place, and it is their job to keep you COVID safe. Now, at the moment, we're not seeing any evidence that where those plans are in place, that the virus is spreading. What we are seeing is the virus is spreading behind private closed doors when people are having barbecues or parties or gathering together in prayer, in celebration, or in mourning. So we are seeing those things that in the patterns, but we're not seeing it where workplaces or faith settings have really good COVID risk in place. And that's why the restriction at this stage is only about people joining and mixing at home. Now, if that doesn't control things, then we may see further restrictions, but we'll hope that it does, because ultimately it's actually not the workplace that's giving you COVID. It's not the temple, it's not the restaurant. It's what you're choosing to do as an individual to break that 2 meter space, to touch and not wash your hands, to not wear a face coverings. These are our individual choices. And although businesses and other settings can help us get it right, it's what we do that means it makes it work or not.
Right, thank you, Doctor. And here I'd like to also give out information about the confirmed cases across UK. Around 360,000 confirmed cases are there in UK at the moment, with 41,000 people who have lost their lives because of coronavirus in hospital, according to the government figures. And we don't know about the people who have lost their lives in their homes or care homes. These figures don't include that. So that's quite a high number, and of course it is an alarm for the people, especially of these three councils where the coronavirus cases have continuously risen in past 2 weeks. Doctor, before we sign off and before we give out instructions to people in Punjabi, what would you like to say in the end and to conclude?
So, first of all, I'd like to say thank you to your viewers. Many of you are doing exactly the right thing. Across our Sikh community, we've seen some fantastic examples of business owners with excellent COVID safety in place, with houses acting responsibly, who are controlling the spread. But unfortunately, that's not everyone's practice. So if someone isn't doing what they should, then please point it out. As a community, we all have to take responsibility for this situation. We all have to own what is going on. And we all have to take action to stop the spread of this dangerous disease, to ensure that we don't end up in a full lockdown and we don't end up losing 1,000 more lives in Birmingham. We can stop this if we take action now, and we all take responsibility for keeping our families safe, our communities safe, and our cities safe.
Thank you, Dr. Wani. That's Dr. Justin Wani from Birmingham City Council. He's the Director of Public Health. And as explained by Dr. Wani, ਸਾਨੂੰ ਸਾਰਿਆਂ ਦੀ ਰਿਸਪੌਂਸਿਬਿਲਿਟੀ ਹੈਗੀ ਆ ਕਿ ਅਸੀਂ ਆਪਣੇ ਆਪਣੇ ਘਰਾਂ ਦੇ ਵਿੱਚ ਵੀ ਤੇ ਬਾਹਰ ਜਦੋਂ ਅਸੀਂ ਜਾਂਦੇ ਹੈਗੇ ਆ, ਅਸੀਂ ਜਿਹੜੇ ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ ਹੈਗੇ ਨੇ ਉਹਨਾਂ ਨੂੰ ਚੰਗੀ ਤਰ੍ਹਾਂ ਫੋਲੋ ਕਰਨਾ ਹੈਗਾ ਆ। ਤੇ ਜਿਹੜੀ ਤਿੰਨ ਮੇਨ ਗਾਈਡਲਾਈਨਸ ਗਵਰਨਮੈਂਟ ਵੱਲੋਂ ਦਿੱਤੀਆਂ ਗਈਆਂ ਨੇ, the first one is to maintain social distancing. Social distancing ਦਾ ਮਤਲਬ ਹੈਗਾ ਆ ਕਿਸੇ ਵੀ ਹੋਰ ਪਰਸਨ ਨਾਲ ਜਿਹੜਾ ਕਿ ਤੁਹਾਡੇ ਨਾਲ ਨਹੀਂ ਰਹਿੰਦਾ ਉਹਨਾਂ ਦੇ ਨਾਲ ਹਮੇਸ਼ਾ ਤੁਸੀਂ 2 ਮੀਟਰ ਦੀ ਦੂਰੀ ਰੱਖਣੀ ਹੈਗੀ ਆ। ਜਾਂ ਤੁਸੀਂ ਗੁਰਦੁਆਰੇ ਜਾਂਦੇ ਆ, ਜੇ ਤੁਸੀਂ ਗਰੋਸਰੀ ਸ਼ਾਪਿੰਗ ਜਾਂਦੇ ਆ, ਤੁਸੀਂ ਕਿਤੇ ਸਟਰੀਟ ਤੇ ਹੈਗੇ ਆ, ਹਮੇਸ਼ਾ ਤੁਸੀਂ ਦੂਸਰਿਆਂ ਨਾਲ 2 ਮੀਟਰ ਦੀ ਦੂਰੀ ਰੱਖਣੀ ਹੈਗੀ ਆ, ਜਿਹਨੂੰ ਅਸੀਂ ਸੋਸ਼ਲ ਡਿਸਟੈਂਸਿੰਗ ਕਹਿੰਦੇ ਹੈਗੇ ਆ, ਤਾਂ ਕਿ ਜਿਹੜਾ ਵਾਇਰਸ ਦਾ ਸਪਰੈਡ ਹੋਣ ਦਾ ਚਾਂਸ ਹੈਗਾ ਆ ਕਿਸੇ ਹੋਰ ਦਾ ਤੋਂ ਤੁਹਾਡੇ ਕੋਲ ਉਹ ਘੱਟ ਹੋ ਜਾਏ। ਸੈਕੰਡਲੀ, ਫੇਸ ਮਾਸਕਸ ਜਿਹੜਾ ਪਾਉਣ ਦੀ ਗਾਈਡਲਾਈਨ ਗਵਰਨਮੈਂਟ ਵੱਲੋਂ ਦਿੱਤੀ ਗਈ ਹੈਗੀ ਆ। ਤੁਸੀਂ ਜ਼ਰੂਰੀ ਨਹੀਂ ਹੈਗਾ ਕਿ ਤੁਸੀਂ ਸਰਜੀਕਲ ਮਾਸਕ ਹੀ ਪਾਉਣਾ ਹੈਗਾ। ਗਵਰਨਮੈਂਟ ਵੱਲੋਂ ਖੁੱਲੀ ਛੂਟ ਹੈਗੀ ਆ ਕਿ ਤੁਸੀਂ ਆਪਣੇ ਘਰ 'ਚ ਸਿੰਪਲ ਕੱਪੜੇ ਦਾ ਵੀ ਇੱਕ ਫੇਸ ਕਵਰਿੰਗ ਬਣਾ ਸਕਦੇ ਆ ਤੇ ਉਹਨੂੰ ਵੀ ਯੂਜ਼ ਕਰ ਸਕਦੇ ਹੈਗੇ ਆ। ਤੇ ਹਮੇਸ਼ਾ ਫੇਸ ਮਾਸਕ ਬਾਹਰ ਪਬਲਿਕ ਪਲੇਸਿਸ ਦੇ ਵਿੱਚ, ਜਾਂ ਤੁਸੀਂ ਪਬਲਿਕ ਟਰਾਂਸਪੋਰਟ ਬੱਸਿਸ ਯੂਜ਼ ਕਰ ਰਹੇ ਆ, ਟੈਕਸੀਜ਼ ਯੂਜ਼ ਕਰ ਰਹੇ ਆ, ਤੁਸੀਂ ਹਮੇਸ਼ਾ ਫੇਸ ਕਵਰਿੰਗ ਜ਼ਰੂਰ ਪਾ ਕੇ ਰੱਖਣੀ ਹੈਗੀ ਆ। ਹੁਣ ਗੁਰਦੁਆਰਿਆਂ ਵਿੱਚ ਵੀ ਛੇਤੀ ਹੀ ਇਹ ਗਾਈਡਲਾਈਨ ਜਿਹੜੀ ਆ ਲਾਗੂ ਕਰ ਦਿੱਤੀ ਜਾਏਗੀ। ਜਦੋਂ ਵੀ ਅਸੀਂ ਗੁਰਦੁਆਰੇ ਜਾਂਦੇ ਹੈਗੇ ਆ ਉਦੋਂ ਵੀ ਸਾਨੂੰ ਫੇਸ ਕਵਰਿੰਗ ਹਮੇਸ਼ਾ ਪਾ ਕੇ ਰੱਖਣੀ ਚਾਹੀਦੀ ਹੈਗੀ ਆ। ਥਰਡਲੀ, ਗਵਰਨਮੈਂਟ ਦੀ ਗਾਈਡਲਾਈਨ ਹੈਗੀ ਆ ਕਿ ਤੁਸੀਂ ਆਪਣਾ ਪਰਸਨਲ ਹਾਈਜੀਨ ਹਮੇਸ਼ਾ ਮੇਨਟੇਨ ਕਰਨਾ ਹੈਗਾ, ਜਿਹਦੇ ਵਿੱਚ ਹੱਥ ਧੋਣਾ ਆਉਂਦਾ ਹੈ। ਜਦੋਂ ਤੁਸੀਂ ਬਾਹਰ ਜਾਂਦੇ ਆ, ਇੱਕ ਛੋਟੀ ਸੈਨੀਟਾਈਜ਼ਰ ਦੀ ਬੋਟਲ ਜਿਹੜੀ ਆ ਆਪਣੇ ਕੋਲ ਜ਼ਰੂਰ ਰੱਖੋ। ਜੇ ਤੁਸੀਂ ਹੱਥ ਬਾਹਰ ਨਹੀਂ ਧੋ ਸਕਦੇ, ਸੋਪ ਐਂਡ ਵਾਟਰ ਦੀ ਐਕਸੈਸ ਨਹੀਂ ਹੈਗੀ, ਤੁਸੀਂ ਸੈਨੀਟਾਈਜ਼ਰ ਯੂਜ਼ ਕਰ ਸਕਦੇ ਆ। ਲੇਕਿਨ ਬੈਸਟ ਹੈਗਾ ਹੈ ਕਿ ਤੁਸੀਂ ਟਾਈਮ ਟੂ ਟਾਈਮ ਆਪਣੇ ਜਿਹੜੇ ਹੱਥ ਹੈ ਜ਼ਰੂਰ ਧੋਂਦੇ ਰਹੋ, ਤੇ ਜਿੰਨਾ ਜ਼ਿਆਦਾ ਹੋ ਸਕੇ ਹੱਥਾਂ ਨੂੰ ਫੇਸ ਤੇ ਟੱਚ ਕਰਨਾ ਅਵੋਇਡ ਕਰੋ। ਤੇ ਬਾਹਰ ਤੋਂ ਆਉਣ ਤੋਂ ਬਾਅਦ ਇਸ ਤੋਂ ਪਹਿਲਾਂ ਕਿ ਤੁਸੀਂ ਆਪਣੇ ਬੱਚਿਆਂ ਨੂੰ ਟੱਚ ਕਰੋ, ਉਹਨਾਂ ਨੂੰ ਮਿਲੋ, ਆਪਣੇ ਹੱਥ ਜ਼ਰੂਰ ਧੋ ਲਓ। ਐਂਡ ਬਾਹਰ ਤੋਂ ਜਦੋਂ ਤੁਸੀਂ ਕੋਈ ਵੀ ਚੀਜ਼ ਲੈ ਕੇ ਆਉਂਦੇ ਆ, ਸਪੈਸ਼ਲੀ ਗਰੋਸਰੀ ਸ਼ਾਪਿੰਗ ਜਦੋਂ ਕਰਕੇ ਆਉਂਦੇ ਆ, ਉਹਨਾਂ ਚੀਜ਼ਾਂ ਨੂੰ ਵੀ ਇੱਕ ਵਾਰੀ ਸੈਨੀਟਾਈਜ਼ਰ ਨਾਲ ਤੁਸੀਂ ਸਾਫ਼ ਕਰ ਸਕਦੇ ਆ। ਜੇ ਸਬਜ਼ੀਆਂ ਹੈਗੀਆਂ ਤਾਂ ਤੁਸੀਂ ਧੋ ਸਕਦੇ ਆ। ਪਰਸਨਲ ਹਾਈਜੀਨ ਦੇ ਵਿੱਚ ਇਹ ਸਾਰੀ ਚੀਜ਼ਾਂ ਆਉਂਦੀਆਂ ਨੇ। ਜਦੋਂ ਤੱਕ ਐਜ਼ ਕਮਿਊਨਿਟੀ ਅਸੀਂ ਇਹ 3 ਗਾਈਡਲਾਈਨਸ ਫੋਲੋ ਨਹੀਂ ਕਰਦੇ, ਕਰੋਨਾ ਵਾਇਰਸ ਦਾ ਜਿਹੜਾ ਰਿਸਕ ਹੈਗਾ ਆ ਉਹ ਇੱਦਾਂ ਹੀ ਮੇਨਟੇਨ ਰਹਿਣਾ ਹੈਗਾ। ਐਂਡ ਉਸੇ ਨੂੰ ਘੱਟ ਕਰਨ ਵਾਸਤੇ ਤਾਂ ਕਿ ਇੰਗਲੈਂਡ ਦੇ ਵਿੱਚ ਦੁਬਾਰਾ ਤੋਂ ਸੈਕੰਡ ਲਾਕਡਾਊਨ ਜਿੱਦਾਂ ਅਸੀਂ ਪਿਛਲੇ 6 ਮਹੀਨੇ ਦੇ ਵਿੱਚ ਦੇਖ ਚੁੱਕੇ ਹਾਂ, ਇੱਦਾਂ ਦੀ ਸਿਚੁਏਸ਼ਨ ਦੁਬਾਰਾ ਨਾ ਹੋਏ ਤਾਂ ਕਰਕੇ ਹੁਣ ਗਵਰਨਮੈਂਟ ਆਪਣੇ ਥੋੜ੍ਹੇ ਸਟੈਪਸ ਲੈ ਰਹੀ ਹੈਗੀ ਆ। ਲੋਕਲ ਲਾਕਡਾਊਨ, ਲੋਕਲ ਰਿਸਟ੍ਰਿਕਸ਼ਨਸ ਪਾ ਰਹੀ ਹੈਗੀ ਆ, ਜਿਹਦੇ ਵਿੱਚ ਹੁਣ ਬਰਮਿੰਘਮ, ਸੋਲੀਹੁਲ ਤੇ ਸੈਂਡਵਿਲ ਦੇ ਵਿੱਚ ਕਿਸੇ ਵੀ ਦੋ ਘਰਾਂ ਦੇ ਜਿਹੜੇ ਮੈਂਬਰਸ ਨੇ ਇੱਕ ਦੂਸਰੇ ਨਾਲ ਨਹੀਂ ਮਿਲ ਸਕਦੇ। ਤੁਸੀਂ ਕਿਸੇ ਹੋਰ ਦੇ ਘਰ ਜਾਣਾ ਅਵੋਇਡ ਕਰੋ ਥੋੜ੍ਹੇ ਟਾਈਮ ਵਾਸਤੇ। ਤੁਸੀਂ ਸਿਰਫ ਬਾਹਰ ਕਿਤੇ ਪਾਰਕ ਦੇ ਵਿੱਚ ਹੀ ਉਹਨਾਂ ਦੇ ਨਾਲ ਮਿਲ ਸਕਦੇ ਹੈਗੇ ਆ। ਉਹਦੇ ਵਿੱਚ ਵੀ ਤੁਸੀਂ 6 ਤੋਂ ਜ਼ਿਆਦਾ ਲੋਕ ਮਿਲਣਾ ਅਵੋਇਡ ਕਰਨਾ ਹੈਗਾ ਆ। ਓਵਰਆਲ ਯੂਕੇ ਦੇ ਵਿੱਚ ਇਹ ਰਿਸਟ੍ਰਿਕਸ਼ਨ ਹੁਣ 15 ਸਤੰਬਰ ਤੋਂ ਲਾਗੂ ਹੋ ਗਏ ਨੇ। Although the government has urged people to start acting on these restrictions immediately. So as a good citizen ਸਾਡਾ ਇਹ ਫਰਜ਼ ਬਣਦਾ ਹੈਗਾ ਆ ਕਿ ਅਸੀਂ ਇਹ ਸਾਰੀ restrictions ਤੇ ਸਾਰੀ ਜਿਹੜੀ ਗਾਈਡਲਾਈਨਸ ਆ ਉਹਨਾਂ ਨੂੰ ਫੋਲੋ ਕਰੀਏ ਸਾਡੇ ਆਪਣੇ ਭਲੇ ਵਾਸਤੇ। So ਇਹ ਸੀਗੇ Dr. Justin Warney from Birmingham City Council, the Director of Public Health. Doctor, thank you so much for joining Sikh channel, and everything that you have said has been really helpful. Hopefully people watching this show will act on these restrictions, and we'll continue to communicate with you as we have new updates regarding all these restrictions. Thank you so much for joining Sikh channel.
Thank you for having